Hi, I'm Katie Keel. I'm a nurse practitioner here at Midstate.
I'm Anna Wildman. I'm the laser tech and medical esthetician here.
And we are here for our Fact or Fiction series, and will dispel the most common myths and misconceptions in aesthetics.
This is probably our favorite subject that we talk about all the time.
Yes. So one of the most common things I hear is filler looks fake, or filler will make me look like a different person, which that is not true. In the right injector's hands, you will just look like the best, most rested, vibrant version of yourself. Of course, we have preconceived notions of noticeable work done, but just know that for every one person walking around that had noticeable work, there were probably 100 or more walking around who you just thought they were genetically blessed or lucky.
They're not.
They're not. We're all doing the same
Most
thing.
Of them.
Exactly. So, okay, you're on.
Okay. So I probably hear, so I do laser hair removal. And so when I tell my patients that they're going to have to shave the area before they come in, especially their face, they immediately have a mini heart attack, and I have to bring them down and let them know that the myth of shaving your face is going to make it 10 times worse, and you're going to grow this full beard and mustache and all this. The reality of it is actually tweezing or waxing that area is going to make it 10 times worse than shaving that area. When you tweeze something out of the follicle, it activates that follicle to actually grow more hair. So if you shave that area, it's not activating anything. And your skincare products penetrate the skin better when you shave your face. Your makeup looks better on that. So it's actually a good thing to shave the face. And I do a dry shave. So it's fiction. It's not fact.
Yeah. If that were the case, any man would be able to grow a full beard, and there's plenty of men out there who can't grow beards. They shave all the time. Your follicle deep within your skin is not going to change just from taking the top off. I think that came from teenage boys started shaving their face, and their hair was getting thicker and darker hormonally, naturally.
Right.
And then people thought that caused it.
Right.
And it wasn't.
Just a coincidence.
It was happening anyways. Yeah. Like that was why they were shaving.
Yeah. So I've been shaving my face for 10 years, and I don't have a beard. So we're good.
I shave my face. Like I said, there's clinical evidence that it does make your products that you're absorbing actually penetrate the skin better. Less hair can sometimes, in some patients, produce less oil too, because your body isn't having to hydrate that hair.
And, you are doing a little bit of exfoliation. So they did a study years and years ago. We could talk about this all day.
I know.
Did this study years ago. Why do men not age as fast as women do, especially around the mouth? And one of the main reasons is because men shave their face. Most men shave their face. And so they're kind of removing that top layer of just keratin off the top layer of the skin. And so, so shave your face, people.
Okay, next one. There's no perfect age to start injectables. So it's whenever something bothers you, I would say address it then. That might be a different age for you compared to your best friend, but what's right for you is not necessarily right for her. We'll call them tweakments. So a little bit done early you could be proactive. So there's being proactive with your skincare versus being corrective. And hopefully there can be a picture place right here that shows what I mean, because the picture in mine is they're both 66 years old and they both look drastically different. So, whether it's just wearing sunscreen or using a retinol or, coming seeing Anna getting some laser treatments done, injectables, Botox, Dysport, fillers, whatever it is, whatever's bothering you, whatever's right for you, come in so we can make a consultation and a plan. So,
well, I think the other thing for people to remember too is it's easy to prevent than correct. So, preventing a wrinkle in your forehead with Botox at a younger age, is easier instead of coming in, when you have this really deep wrinkle and it's already set in and it's still getting worse and all of that, for us to try to correct
more
that.
Money to have less of a result.
Right.
So in the long run.
For sure. I think the other misconception or fact or fiction is that lasers have tons of downtime. And I think the misconception of that is that, we do have lasers that you do have lots of downtime. Those are resurfacing lasers. But we also have lasers that nobody would know you had that treatment done the next day. You can wear makeup, you can kind of go about your business. You might look a little dirty, because your pigment's kind of coming up. You might feel a little sandy from Moxie laser. But I mean, I come to work, we do lasers all the time on ourselves, and I come to work, I have my makeup on, and I'm good to go, So I think that, the misconception is that people kind of shy away from laser treatments because, they think they're going to have 2 weeks downtime and not going to be able to go to work, or they're not be able to, be on the boat or whatever. So we do have options, for you that you don't have to have that downtime, and you're still getting results too. So,
and I'll say this, you'll never go wrong with doing something that's going to improve the health and quality of your skin. You could have all the Botox in the world, all the fillers in the world, and if your skin quality isn't where it needs to be, nothing 100%. Else matters.
Yes.
And so that visit Anna. Start now.
We're gonna laser you up.
Yeah. So next would be one treatment will fix everything. Okay. So if you have had a line, say the lines between your eyebrows, if you have had those for 30 years, they're not going to be completely gone with one treatment.
It took you a lot of work,
yes, to make those.
To create that line.
But that being said, with continued treatment, we can make a great impact on whatever it is that's bothering you. But it's not going to be a one and done thing. This is a journey together. This is a relationship we're all going to have together. This is the beginning of our friendship, not a one and done thing. So
we're going to all become best friends.
Exactly.
I think kind of on that too, nothing is permanent. We think that, you can come in, you can get one laser treatment and you're good to go, and unfortunately, that's not reality. It's kind of the same idea as, I brushed my teeth yesterday, so I don't have to do it today, that's just not, obviously, we all know that that's not the case. You can't go to the gym one time and be in great shape. You have to keep going. You have to eat right. You have to do all of the things, and it takes all of the things to get to that, that end result and maintaining what you already have. So I think that kind of goes
aging. You're still going to be on the boat getting sun. I mean, we live in Florida. We live where other people vacation, and
even walking to and from the car, going to the grocery store, driving, the left side's always worse than the right side because we're driving in that, that sun's hitting us there. So, it's definitely
pollution, genetics. You're constantly, your skin is
phones,
constantly under
computers,
all the things.
Everything hurts your skin.
Another thing, a lot of patients will say that they don't want this because they're afraid it's going to hurt. Most of the patients, by the time we're done, they say that was it. Oh, I had heard this was
it's
painful.
So fast.
Yeah. It's so fast. It does not hurt. We have lots of, topical numbings, injectable numbing, lots of techniques that we can use in order to make this a very comfortable process.
Right.
So don't let that be the thing that scares you away from, doing something that you want to do.
For sure. Yeah, that's a good point. I think that the other factor fiction is if I use this eye cream, it's going to take away my wrinkles.
Or my bags.
Yeah. And so unfortunately, skincare is not going to take away things. It's not going to fix what's already there. It can help prevent future, and it can reverse a little bit of softening lines, helping hydration and texture and things like that. But you can't just rely on skincare at home. It's very important. We always recommend, certain things to use at home, vitamin C serums, hyaluronic acid, SPF, night creams, all of that. But it's not going to necessarily fix what you already have, So I think the reality is, just having the expectations of, maybe seeing a little bit softer, around the eyes or a little bit better texture and things like that. Skincare has its place, but that's not the only thing that's going to really change your skin. It kind of takes a village, it takes lasers and injections and home care and all of that.
But it is still important. I mean,
it is very important.
I love analogies. Okay, so my analogy for this is imagine I got to say one at least today.
At least one.
So imagine if you had this beautiful dress. Oh my goodness, it was gorgeous. It was pricey but worth it. It says dry clean only. You are not going to go home and throw it in the washer and dryer on the hottest settings possible, right? Hopefully not. So same thing. You're investing money in your getting lasers, injectables, buy the good products to make your results be taken to the next level.
And they don't have to be super expensive.
No, and they don't have to be a lot. I mean, you have like 4 basic points. Invest your money there, with some good actives rather than just moisturizing. Your product should have something active in it, and by that I mean like a vitamin C, a retinol, something like that, that will actually change your skin.
Yes, love it.
Does it matter? Yeah,
I think it's your
turn.
Okay,
so kind of alluding to the one treatment will fix everything, and once you start, you'll be unable to stop. So ideally, why would you want to stop a good thing? But no, you can stop this stuff whenever you want to stop. Whatever rewind we gave your skin to whatever age or health, it's just like pressing play from that spot. So you can stop whenever you want. It's like doing anything. If you want to keep your teeth, you keep brushing them and going to the dentist. If you don't want to keep your teeth, just
then stop brushing them.
But why would you want to? Right?
Yeah. That's a really good point. Okay, pore size. Can your pores be shrunk? That is a no. It's a hard no. But as we start aging, our pore size starts to get larger because our collagen starts to break down. So usually that kind of happens around this area. You start to really notice around this area on the nose part, some on the chin, a little on the forehead. So there are things that we can do to induce your collagen, to kind of build that collagen back up. But we're not shrinking your pores. A topical product is not going to shrink your pores. But there are things that we can do to help prevent them from getting worse and also to help them look better now. But it's a process. You have to kind of do some treatments in a row and then, continue to do 1 or 2 treatments, a year, just to kind of keep that collagen built in the skin. But we're not shrinking pores. If anybody tells you that, run. But we can improve them. So I think that's a big myth too.
So if we missed anything today, if there are any other questions you have, any other myths or misconceptions
we love,
yes, please.
We love myths.
Send them.
Or if you have something that you have always heard and you just knew it was the truth and you're not sure anymore, ask us. We would love to respond. Yeah. So,
well, thank you.
Have an awesome day, guys.
Bye. Hi, I'm Katie Keel. I'm a nurse practitioner here at Midstate.
I'm Anna Wildman. Oh. Okay, let's start that over.
Already. Off the bat. I didn't have to say my last name. Sorry for messing you up.
Okay.
What if there's another Katie? Okay.